I am Dr. Ganesh Aravind from Trichy. I am a consultant nephrologist practicing in Frontline Hospital and assistant professor in Srinivasan Medical College. I did my MD General Medicine in Kilpauk Medical College and DM Nephrology from Madras Medical College. And I was practicing for last 5 to 6 years in Trichy. So, coming to the topic, today the topic for discussion is pedal edema in chronic kidney disease, causes, symptoms and treatment. Prior to getting into pedal edema, let us have a small introduction into chronic kidney disease. Actually, kidney is a vital organ. It is a pad structure which is located in the abdomen in the retroperitoneal area, and it functions in multiple way, and it maintains acid-base balance of the body, blood pressure regulation, clearance, that is clearance of toxins and waste products from the body, and drug metabolism, and it has endocrine function like synthesis of erythropoietin, which is important to produce red blood cells, and activation of vitamin D3, which is essential for bone mineralization. And it also has many other functions. With that introductory function, let us get into CKD. CKD is nothing but it is a irreversible damage of kidney. As per KDIGO definition, chronic kidney disease is defined as kidney dysfunction or structural abnormality lasting for more than 3 months. Any kidney failure which lasts for more than 3 months becomes irreversible, and it is termed as chronic kidney disease. Chronic means long standing. Kidney disease, here the form is failure of kidneys. And it is of 5 stages based on glomerular filtration rate. Glomerular filtration rate is nothing but the way the kidney functions is being estimated, and this is being estimated using serum creatinine. Serum creatinine is routinely done investigation to assess the renal function. With serum creatinine, we estimate glomerular filtration rate without doing much test in the patient, and based on the estimated glomerular filtration rate, CKD is being classified into 5 stages. Stage 1, when the glomerular, normally the estimated glomerular filtration rate will be more than 100, it will be roughly around 120 ml per minute. When it falls less than 90, then it becomes stage 2 CKD. When it is between 30 to 60, it is stage 3 CKD. When it is between 15 to 30 ml per minute, it is stage 4 CKD. And when the eGFR falls less than 15, then it is stage 5 chronic kidney disease. And generally, chronic kidney disease patient will not have early manifestation, because this is a gradual onset renal failure where patient will have compensatory mechanism so that they doesn't have any significant manifestation. At the earlier phase, the patient may have little bit of fatigueness which may not be noticed by most of the patient. When the patient comes to stage 3 or stage 4 CKD, they will start showing some sort of manifestation. Usually, chronic kidney disease patient will have multi-organ symptoms, such as they can have swelling of legs and ankle, that is pedal edema, or generalized swelling of the body, which is called as anasarca, and he may have breathlessness on exertion, GI symptoms like nausea, vomiting, things like that. Hiccups can happen in late stages of renal failure, and he can have distress during walking, and cough expectoration, which is more of frothiness because of cardiac compromise or volume overload, and patient may have reduced mental apprehension or status. Patient may have disorientation and loss of consciousness, seizures in the terminal phase of end-stage renal disease. And similar complications can also affect skin and other organs too. So these are the symptoms of chronic kidney disease. Here today we are going to focus particularly on pedal edema. Let us come to the today's talk, that is pedal edema in chronic kidney disease. Pedal edema, as we told, let us get into the cause. Generally, a tissue gets swollen or becomes edematous, or the fluids seeps into the tissue. This is called as edematous tissue. For a tissue to become edematous or swollen, there are three factors. One, there should be hydrostatic pressure, that means a force which pushes the fluid out of the blood vessels, or an oncotic pressure, that is a force which tries to retain the fluid within the blood vessel. And third is lymphatics. It is a system which removes the fluid from the tissues. So these are the three reasons which are primarily responsible for a tissue to get swollen or an edema to happen. Here in CKD, there are two factors which are responsible for swelling of legs, that is pedal edema. One is hydrostatic pressure, which is primarily because of the renal failure per se, and second is reduced oncotic pressure, because renal failure patient loses albumin through their urine, causing hypoalbuminemia, resulting in reduced oncotic pressure, which causes reduced oncotic pressure, so that blood vessels cannot hold fluids within the vessels. Hence, fluids seeps out of the vessels into the tissue, causing pedal edema. So this is the cause for or pathogenesis of pedal edema in CKD. And coming to that of symptoms is nothing but, as we are discussing about the pedal edema is nothing but the swelling of legs, foot and ankle. The tissue gets bigger or swollen because of fluid in the subcutaneous plane or the muscular plane, and this is pedal edema. And because of that there is fluid accumulation within the tissue. The skin over the tissue appears stretchy. In some cases, the stretchy skin may give away, causing seepage of fluid out of the skin directly. And when we examine, by applying the pressure on the foot, we can see dimpling or pitting of the swollen limb. So this is about the symptoms. And then coming to the treatment, generally for whatever disease, treatment is of two types. One is treating the cause, and second is treating the effect. Meaning here the pedal edema is being caused by chronic kidney disease, and the effect is swelling of the tissue. So CKD cannot be treated. The only thing which we can do is delay the progression of the disease. And since CKD cannot be treated, here we have to focus more on the treatment of effect, that is treating the pedal edema as such using the drugs. This is called a symptomatic management of pedal edema. So coming to symptomatic management of pedal edema, the first thing we can do is ask the patient to have reduced fluid intake or reduce his salt intake. So low salt intake and reduced fluid intake can reduce the extent of pedal edema. This is one thing. This is a dietary advice. And second thing is a therapeutic management. Here comes the role of diuretics. Diuretics are nothing but a group of drugs which enhances the fluid excretion out of the body through the kidney. These are drugs which specifically acts on the tubules, causing an enhanced fluid output, urine output. So these are the group of drugs which we call it as diuretics. There are diuretics of different classes. One is loop diuretic, thiazide diuretic and adjuvant diuretics. Here the loop diuretic is a high ceiling diuretic, meaning it has a maximum action because it acts on the loop of Henle, which is an organ of concentration. So when we target this loop of Henle, patient will have maximum amount of urine output. So these are the group of drugs which can be more helpful in a patient with chronic kidney disease, particularly when the patient has a stage 4 or 5 CKD. So among which the commonest drugs which we use is furosemide and torsemide, and torsemide has aging advantage over furosemide. And the second thing is the third thing. The first is dietary, second is therapeutic, and third is supportive. Supportive, here we can just do body positioning, elevation of limb. So the lower limb can be elevated, can be held in a higher position above the level of heart, so that will cause more amount of fluid getting into the dependent spaces, thereby reducing the pedal edema. But the problem with this positioning, body positioning, is that if a patient is having a compromised heart, this is not right, because the patient may land up in pulmonary edema and a sort of cardiac failure. So this may not be suggested in most of the occasion. And the fourth thing is the compressive stockings. The compressive stockings is a one which can be used to prevent pedal edema, as well as if a patient is having somewhat a refractory pedal edema, it can act as an adjuvant to have a squeezing effect over the tissue directly, causing a pushing up of fluids into the blood vessels. So these are the four ways how we can just treat the pedal edema in a symptomatic manner. So with that, we just conclude the topic of pedal edema in chronic kidney disease. But we should always remember that CKD is a disease where there is no promising therapies. So it is a disease where dietary management and control of sugars and blood pressure is going to have a important scaffold in the treatment protocol. That means it forms the crux of the treatment. By doing such maneuvering, we can just delay the progression of disease. So CKD, once it is being established, here the management is only a supportive management which can target only delaying the initiation of hemodialysis, that is delaying the progression of disease. So with that, I just conclude my talk. Thank you very much.